Hi, I'm Erin Gordon, one of the CPMC genetic counselors. Before you view your results, I'd like to give you some important information about what your results can and cannot tell you. When viewing your results for any condition, it's important to remember that the testing done by the CPMC only looks at your risk of certain diseases, but cannot diagnose a medical condition. If you think you're having symptoms of a condition, please contact your medical provider.
Age-related macular degeneration is a slowly progressive eye disease, where part of the eye, called the macula, gradually breaks down over time. The macula is part of the eye that helps with sharp central vision. Central vision is needed for driving, reading, recognizing faces, and working with fine details. There are two types of age-related macular degeneration, dry and wet. The dry form is far more common, and it's characterized by drusen, which are yellowish deposits that form within the layers of the retina and as a loss of pigment in the retina. The wet form is seen less often and is characterized by bleeding in the blood vessels under the retina. This bleeding can cause swelling and scar tissue to form. Typically, the wet form progresses more quickly than the dry form. Age-related macular degeneration is the leading cause of vision loss among people 50 years of age or older in the developed world. The risk for developing this condition increases with age. Symptoms of age-related macular degeneration include trouble recognizing faces, hazy overall vision, blurred or a blind spot in the center of your visual field, and in some cases, blurry vision may improve with brighter lighting. It's important that you tell your doctor if you're experiencing any of these symptoms. There are many factors that make up your overall risk for developing age-related macular degeneration, some of which you can control and some you cannot. The strongest risk factors include age, with individuals over the age of 50 at greatest risk, being female, having a family history of age-related macular degeneration, genetic risk factors, being Caucasian, and smoking. Obesity has also been found by some studies to be a risk factor for age-related macular degeneration. In addition to the non-genetic risk factors that we've just listed, there's a strong genetic component to age-related macular degeneration. It's estimated that about 71% of the variation in the occurrence of this condition in the Caucasian population is due to differences in genetic risk factors, while the remaining 29% of the risk is due to differences in non-genetic factors. It is not possible to diagnose age-related macular degeneration through genetic testing. This condition must be diagnosed by a physician's eye exam. Now let's talk more about your CPMC result and genetic risks for age-related macular degeneration. Remember that we all have two copies of every gene. We inherit one copy from our mother and one copy from our father. This means that for every genetic variant the CPMC study looks at, you can have either 0, 1, or 2 copies of the genetic risk variant. Your CPMC results will tell you how many copies of this one genetic risk variant you have. Here you can see that someone with 2 copies of the genetic risk variant has 6 times the risk of developing age-related macular degeneration compared to someone who has 0 copies of the risk variant. Learning your results and how they impact your risk may help motivate you to change other risk factors, like stopping smoking. Remember, age-related macular degeneration is a complex disease, which means that it's caused by a combination of genetic variants in multiple genes and the environment. No single genetic variant causes age-related macular degeneration, so no single genetic variant will completely predict your risk of developing age-related macular degeneration. Results of CPMC testing alone do not diagnose age-related macular degeneration or rule out the chance of developing this condition in the future. Genetic variant information can help estimate your risk of this condition. However, other risk factors like your family history and smoking status may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of age-related macular degeneration in the future. As we learn more, your estimated genetic risk for this condition may change. We'll keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider, contact a CPMC genetic counselor, read the information provided on the CPMC health condition page, or attend a CPMC educational event.